Hello everyone, I am Dr. Prajwith Rai. Today we are going to discuss about arachidonic acid pathway. Now to know arachidonic acid pathway, it becomes important because this plays a major role in case of inflammation, and it also plays a major role in the platelet aggregation during the hemostasis. Now the first step in the arachidonic acid pathway is the conversion of the membrane phospholipids of the cell into arachidonic acid by any stimulus, such as it can be an inflammation or it can be a stimulus for platelet aggregation. The activation of the platelet can stimulate an enzyme called as the phospholipase A2, which will convert the membrane phospholipids into arachidonic acid. Now this arachidonic acid, which can be produced either in the leukocytes, the WBCs, or it can be happening in the platelets or the endothelium. Now whenever the arachidonic acid is acted upon by an enzyme called lipo-oxygenase, it is converted into hydroperoxides. Now what are these hydroperoxides? These are nothing but the leukotrienes. Now these leukotrienes has two important functions. One, it will cause chemotaxis, and it will cause vasoconstriction. Along with that, it has an effect of bronchoconstriction, which will lead to bronchospasm. So that becomes very important in an asthmatic patient. The bronchospasm is because of these leukotrienes. Now, as I told, one thing it causes vasoconstriction, other one is called chemotaxis. Chemotaxis is nothing but once the WBCs or the leukocytes go to the site of the inflammation, because of the leukotriene release of these leukotrienes, more leukocytes will be attracted to this place. So that is what is meant by chemotaxis. Chemo means chemical, taxis means attraction. Now the chemical here is a leukotriene. Now similarly, whenever this arachidonic acid is acted upon by cyclooxygenase, it will convert into endoperoxides. The prostaglandin H is the endoperoxide, which will convert into either thromboxane or prostacyclin or prostaglandin. Again, prostaglandin can be E, prostaglandin can be F. So there are different types of prostaglandins. Now, what are the functions of this? They mainly have their action either on the blood vessel, or they have their action on the platelets, or they have the action on the uterus. These are the main site of action of these the prostaglandins and thromboxane and prostacyclins. Now, what are the specific effect of these chemicals? Now, whenever thromboxane is produced, it will lead to vasoconstriction, and also it will cause platelet aggregation. Now similarly, prostacyclin also causes the platelet aggregation, but it is a vasodilator, and also it relaxes the uterine musculature. Now prostaglandin is also a vasodilator, but it contracts the uterus. So it is used in the induction of labor. Prostaglandin is used during the induction of labor. So it leads to contraction of the uterus, but it is a vasodilator, and it is also a chemical that is responsible for the pain. The pain is because of this release of this prostaglandin. Also, because this is a the vasodilator, whenever there is we need to keep the ductus arteriosus patent in a child, we give prostaglandin to keep the ductus arteriosus patent. So these are the few uses of this prostaglandin. Now, as we saw, the thromboxane is a vasoconstrictor, and then the prostacyclin is a vasodilator. The prostaglandin, which I told was the vasodilator, but it sometimes can act as a vasoconstrictor. So that is what I wanted to show in this. Now, as I told, the phospholipids are converted into arachidonic acid. in the presence of an enzyme called phospholipase. Now, when this will be stimulated, any inflammatory stimuli will stimulate the phospholipase A2 and it will convert the phospholipids into arachidonic acid. Once the phospholipids are converted into free arachidonic acid inside the cell cytoplasma, now this will be used to convert into either hydroperoxidase or into prostaglandins. Now, this phospholipase can be inhibited by using corticosteroids. That's why corticosteroids can be used as an anti-inflammatory agent. Now, arachidonic acid, once it is produced, now it will be acted upon by lipooxygenases in the WBCs and will convert it into the inflammatory mediators, the leukotrienes. So to reduce this inflammation, what we can do, we can inhibit this lipooxygenase by the enzyme, by a drug called ziluton. So ziluton is an inhibitor of lipooxygenase. Now, once the leukotrienes are produced, these leukotrienes are responsible for bronchoconstriction, which is a very severe problem in cases of an asthmatics. So what we can do is we can inhibit these the action of these leukotrienes by a few drugs called as montelukast or zafirlukast. Now these will inhibit the leukotriene receptors and it will prevent the action of leukotrienes causing bronchoconstriction. So that's how we can inhibit the inflammations at the different steps. Now, arachidonic acid is converted into prostaglandins by the help of cyclooxygenase, which can be inhibited by aspirin, NSAIDs and COXIBs. Now, the COX or the cyclooxygenase enzyme is present in many places. Now, they are divided again into COX1 and COX2 depending on their location. The aspirin and NSAID are the non-specific ones. They act on both, whereas the COXIBs act only on the COX2. They are also called as COX2 inhibitors. So that is about the cyclooxygenase inhibitors. Now, why this becomes important is, now this thromboxane and the prostacyclin are important in the platelet aggregation, which can be inhibited by blocking the cyclooxygenase by giving the patient low dose aspirin or NSAIDs, and this is how we can make use of the drugs to prevent the thrombus, the platelet aggregation and the thrombus formation. So that is about arachidonic acid. Thank you everyone.